Listening to both your talks, I'm just struck by how much progress we need to make on the last mile, really helping patients get their care delivery. And I just wanted to throw out an initial question for food for thought. And what are some of the areas that we as a field should be making the biggest investments in to really move the needle to benefit of our patients? I think you alluded to a couple, but I'd love to hear just a discussion back and forth amongst you two on kind of both sides of the coin on where we can make the most impact.
I think anything that fosters, I mean, I'm talking about kind of the communication side right now. Anything that would foster communication and understanding between patients and the healthcare providers could be really helpful. I mean, I kind of alluded to it a little bit during my talk that, when someone is newly diagnosed, all of a sudden, you have all this new language and it's hard to understand what these things mean. What is this scan? What is this clinical trial? What is, this informed consent that someone's showing to me? I don't know, people don't know all the terminology. So, the efforts that are starting to be made to create more lay descriptions of trials and more lay descriptions, plain language descriptions of treatments, I think is very important and could go a long way to helping people. Because if people aren't informed and don't understand what's being asked of them to join and participate in, they're just going to get scared and say no. I mean, that's just, common, human response. So I think that's a really important area right now.
Thanks so much, Ivy. Great answer. And I think it's hard to choose just one thing of what is most important right now in cancer care delivery. I mean, my strongest feeling is that we need to make sure that everyone who's eligible for these optimal treatments is receiving them. And so I have a strong feeling about the need for improved access for universal biomarker testing and just getting people to the right treatments. And I actually was really impressed in some of our research. I'm always continually impressed by the kind of self-organization of people into advocacy groups and the sharing of information. I've learned about people helping each other find clinical trials and find the right treatment. And so I think that that's a really powerful thing, but I also think it's on us in the healthcare system to ensure that the equitable care is happening. So I would say if I had a magic wand, that would be my number one priority. But in terms of the supportive care of people who are living with advanced cancer, we need so much. There's a bill right now in Congress about the Survivorship Care Act, about improving reimbursement for supportive care and survivorship care. It's a little bit focused on early stage cancer, and I think that lung cancer groups could be advocating for the inclusion of advanced cancer survivorship in that, because a lot of the services that people receive for survivorship care or palliative care, honestly, a lot of the supportive care services that people receive are sort of ad hoc. It's what is available at the hospital systems where they are. It's what people, squeaky wheels have the ability to advocate for, or what a particular, the luck of being assigned to a particular clinician who believes in some of these things as to whether people get kind of access to some of these things. So I would say access maybe is the theme here. But in my ideal world, everybody would have access to ideal cancer treatment. And then once everyone knows what their, optimal cancer treatment is, they would automatically have an assessment for the types of supportive care that they need. And it's not going to be the same for everyone. Some people are going to need nutrition support. Some people want help with physical activity. Some people want help with this kind of coping with uncertainty or a group support. Some people want kind of more kind of social support. There's a whole variety of things that people might need help with. But I think, providing a minimum level of care across the board to every single individual is should be where we're aiming, and then have the ability to layer on additional support. And I don't think we're anywhere close to that, despite kind of guidelines and recommendations. I think we know what the gold standard is, but the implementation isn't close to there.
And I just want to add on, I completely agree with Laura about the access issues, biomarker testing access issues. And I wanted to add to something that she mentioned that I thought is really important, how she said some people might need this and some people might need that. Well, I think it's also important just not to assume what patients need and to ask them, because we're all different. We're all, people, we're all different. Some of us might want support in one area, some of us might not. And without having that conversation up front about what your goals are and what's important to you, and getting to know the patient a little bit individually, you just can't just make a blanket decision on how they could be treated. So it's important to try to individualize that as much as possible.